With the evolution of COVID-19, pharmacists in Canada are becoming increasingly concerned about the country's drug supply and what impacts the virus will have on these meds in the long run.
When we first heard about the outbreak making its way to Canada, our first thought was, how are we going to deal with the surge of demand from patients coming in?
First, there was the mass buying at grocery stores. Now it's the new reality for pharmacists working through COVID-19, saying the same is happening with prescription medications.
We started to see our two wholesalers, two major ones, start to show shortages and back orders of not just acute medications like inhalers for respiratory conditions, but also insulin and also chronic medications.
Medications patients can't go without, and the Canadian Pharmacists Association says they've been seeing a tremendous surge in demand across the country.
Especially if we look at China and India and we think proactively, if 70% approximately of active ingredients come from there, and they start to cut down on exports, which after the next 3 months we expect them to.
But Joseph Fanous, who's also the co-founder of the Pharmacists Society of Ontario, is calling for calm, saying pharmacists are already taking measures themselves to ensure no one gets left behind, including limiting supplies for 30 days.
We'd happily give everybody ample supply if we knew that was there, but until we have that assurance from regulators and from wholesalers and from manufacturers, we just have to be judicious about the drug supply in Ontario and in Canada.
The province says they've heard reports that people are asking for refills of up to 6 months.
We want to make sure that everyone can have access to the medications that they need. So we are looking at 30-day refills just to make sure that the supply will remain available for everyone who does need it.
For now, Fanous also says his team has taken their own measures to protect themselves, but he also is calling for more clear guidelines from regulators.
This is the protection measures you can take, and if you do get sick, this is what you can do. Until we get that, we're kind of operating on our own right now.
And his message to Canadians, rest assured pharmacists are on the front lines working around the clock for you.
So basically, pharmacists just want to let their patients know we're on top of it, to be assured.
For City News, I'm Faiza Amin.